Good morning. Thank you for joining us here at the Erie County Rath Building as we take the next step as a community in the fight and defense against COVID-19. I'm joined here by Dr. Gail Burstein and others, including our Director of the Erie County Office of Health Equity, Kelly Wolford, as we'll be receiving our new COVID-19 vaccine shot, which is specifically formulated for the Omicron variants to address the terrible Omicron variant that we dealt with last year. We're joined by Kendra Schmidt from Deaf Access Services to provide the American Sign Language to those who may be watching online. And I thank everyone for being here. This is not a booster, as Dr. Burstein will say. This is actually a reformulated vaccine. We are no longer providing the booster. We're actually not allowed to provide the booster anymore. We can only provide this version of the vaccine. So to those that are like thinking, oh, I'm just going to get another booster, it's going to only be good for like 4 weeks or something like that, as we saw before. No, this is not the case. This is specifically formulated for the new Omicron variants. It appears to have very good reaction and ability to prevent serious illness and death. That is our big worry, of course. There are still people dying in Erie County as a result of COVID-19. People died this month. People died in August. In fact, there has never been a month since the beginning of the pandemic where we have not had a county resident perish from a COVID-19 infection, including approximately 3 weeks ago, an individual in their 30s. And so what we want people to understand is the best way to protect yourself is to get vaccinated with this latest vaccine formulation. I'm going to get my shot as well as others, but I'll turn it over to Dr. Burstein beforehand to talk about the importance of this as well and why this is a better vaccine.
Great, thank you. So as the county executive mentioned, this is a new and improved vaccine. So it not only provides like a little booster for the old variant, the most important is it provides good protection against the Omicron variant, which is what we are seeing now in the community. So there is a good match with the Omicron strain that is in this vaccine and the Omicron that is circulating in this community. So this will provide you with good protection with the currently circulating Omicron variant in our community. So, again, I know that a lot of people think, oh, I've been boosted so many times, I'm so sick of this. This is just not another booster. This is a new vaccine that protects against the Omicron variant. So, a lot of people are eligible in our community. Everybody 12 and up can get one of these new vaccines. So the Pfizer is approved for people 12 and up, and the Moderna is approved for people 18 and up. All we ask is if you completed your vaccine series more than 2 months ago, you can come in and get vaccinated. And then if you received your last booster dose more than 2 months ago, then please come in and get vaccinated. So where to find the COVID boosters? Well, they are available all across the communities. I know all the pharmacies have them. A lot of primary care providers have them. We are also offering them at the county. They're all free of charge. So we're offering them at our 608 William Street Clinic 3 days a week, Monday, Wednesdays, and Thursdays between 9 and 3. On Monday, we're going to be releasing our COVID-19 vaccine clinic schedule, and so you'll be able to find where we are going to be vaccinating throughout the county this month and next month. Stay tuned for that. Also, if for whatever reasons it's difficult for people to get out to get a COVID-19 vaccine, we can come to you. So we work with a couple of great home health providers throughout the county, and you can just give us a call at 716-858-2929, and we'll just take a little bit of information, and one of our home vaccine providers will give you all a call and schedule a time that is convenient for you to come to your house with whatever COVID-19 vaccine that you need, a first dose, second dose, third dose, or a booster dose. And that's it. So now we are going to watch the county executive get his COVID-19 vaccine. And I have to say that I've already got my vaccine. My husband planned last week's date night, and our first stop was to our pharmacy to get a vaccine. Very romantic.
Just remind everybody, when you are going to get the latest vaccine, make sure you bring your card. Makes it so much easier for those that are going to be administering it, so they don't have to look you up in the system. It makes it faster. It's been since my last booster was in April, so I easily qualified, and I'm about to get my latest dose so that I can be protected. I want people to remember this is really kind of turned into what we often saw and we just deal with the flu. We're going to get annual flu shot, and probably in all likelihood we're going to be getting annual COVID shots. And that's okay. I'd much rather get a shot to protect me annually than to risk potential issues associated with COVID-19, because it's still out there, it's still infecting people. Most people that get infected don't have an issue, but there are individuals today in Erie County who are in the hospital with COVID-19, and unfortunately, though infrequently, but there are people who are still perishing in our county as a result of COVID-19. So we have one of our great nurses from the Department of Health. I'm going to get it in the left arm. Gotten in the left arm every time, and it seemed to work well. Never really had a bad reaction. I've learned my lesson. Don't wear a dress shirt and all kinds of other stuff. Drew, why don't you get a photo of this? The only guy who gets photo in Erie County getting shot. Very easy. Because of the great work that Phil thing. All right, thank you very much. Anybody else getting it right now or waiting? This is. Thank you.
I am Kelly Wolford, the Director of the Erie County Office of Health Equity.
Can you give us some running commentary during Soul?
Okay. Easy breezy. I think it is important for many reasons to be vaccinated, not just for myself, but also for my family, for my friends. And I am thankful that we have protection under the new variant to be able to address the Omicron virus. So the more folks that are vaccinated, honestly, the healthier we can all be.
Yeah, could you go ahead?
Thank you very much. We're waiting for the latest mortality report, which we've been getting primarily like Friday afternoons. And it's possible that within the next week or two, Erie County will have surpassed more than 3,000 COVID deaths since the beginning of the pandemic, which we just had the 21st anniversary of the tragic day of September 11th, in which we lost 2,977 people on that one day. Well, very soon we're going to have more people that have perished in Erie County from COVID than were lost on September 11th. And we know that the variant is still out there. COVID-19 is still out there because there are people that are catching it. Most people, as we said, they catch it. They will have a minor illness if they're vaccinated. If they're not vaccinated, they can get serious illness, and there are, as I said, people still dying in our community. So that's why it's very important that you get this latest vaccine to protect you from Omicron, which, correct me if I'm wrong, this is the first time a vaccine was specifically formulated for Omicron.
That's correct. Another tool for secondary prevention is if people do fall ill with COVID-19 and they're at high risk of becoming very ill, where they have a comorbidity or they're a senior, you should talk to your healthcare provider about getting an antiviral prescription. We have to treat the COVID-19 infection. That'll hopefully prevent you from winding up in the hospital, whether you've had a vaccine or not. So that is another tool that we have to prevent people ending up in the hospital and potentially dying from COVID-19. So that's also another thing to remember. You call your healthcare provider for an antiviral if you meet one of those criteria for treatment for COVID-19. At Erie County Health Department, if everybody who we test and for COVID-19 and test positive, and is eligible for an antiviral, we offer them a prescription for an antiviral and we send it into their pharmacy of choice. So remember that is still a tool that we have in our community that people shouldn't forget about.
And once again, people can call 858-2929 to schedule a vaccine appointment for Monday, Wednesday, and Thursday at the 608 William Street Clinic. You can also go online and schedule the appointment. The most important thing we want people to know is the fall is here. Beautiful weather for the fall. What we saw in past years, that COVID-19 prevalence went up, not just in our community, but across the United States during the colder months. And if that's the case again this year, and with most viral issues that we've dealt with in the past, they always seem to go up in the fall. We do expect an increase in COVID-19, and therefore the best way to protect yourself is to get this new vaccine. Blue, is your question?
Yeah, people who are still dying, are they not vaccinated? Are they partly vaccinated? Is there a trend? What do we know?
For what we know, if we review the medical records from HealthyLink, we, through our case investigation through Epi, we know that many people are vaccinated, and however many there are people who are not vaccinated. That's why it's really important if you're ill with COVID-19 and you have one of those risk factors. We're seeing the people that are dying, unfortunately, are our seniors. They're at very high risk of becoming very ill from COVID-19, and then people with comorbidities. So it's really important to make sure that if you are infected with COVID-19 and you do have one of these risk factors with age or comorbidity, you contact your healthcare provider and get a prescription for an antiviral. So vaccines are very effective, and we know that because even though we have more COVID this summer than we ever had during the whole pandemic, and we know that from looking at our wastewater data, because most people aren't testing, so we don't have reported tests, but everybody's peeing and pooing, so we're seeing a lot of virus in our wastewater. So despite these very, very high levels of community COVID-19 infection, we're still seeing very few people in the hospital, and unfortunately some deaths, but not the number of deaths like we had with Delta. So we know that the vaccine in general is giving our community good immunity and good protection, but there's, we have to use every tool in the toolbox we can, and the vaccine is a very important tool.
One thing I would add is when it comes to the hospitalizations, and it's something that we're concerned about with regards to the potential kaleidoscope and the impact it would have. There are still individuals on a daily basis that are hospitalized. I think the most recent report showed, I think, 31 or 32 patients that were specifically hospitalized for COVID-19. Now that's a very low number compared to what we saw, so we're happy to see that. But individuals that are being hospitalized or dying are individuals who have been unvaccinated, those who have received partial vaccination, maybe they completed the initial series but they never got a booster, and often for those who died that are over the age of 75, they have been fully vaccinated and boosted, but they are at a risk because of their age or comorbidities that when they catch it, they get seriously ill. So if you are older and have comorbidities, you should still consider in the community, maybe when I go out, I should be wearing a mask. If I'm even vaccinated, you still have a risk of death, though it is very small. And the one thing that is also noticeable is the percentage of individuals who have died that are unvaccinated is much greater based on the percentage of those who are vaccinated. So if you're unvaccinated, your risk of serious illness or death is still extremely, or much higher than someone who's been vaccinated. Kevin?
Dr. Burstein, you earlier alluded to COVID fatigue, vaccine fatigue, and some people are, it's a hard line. Folks are for it, folks are against it. Some folks just aren't going to take this new vaccine, they aren't going to do it. What do you say to those people? What do you say to folks who just, or even those who got the vaccine and just don't want to get another one?
Well, there's several reasons. One, to get the COVID-19 vaccine. Even if you feel like you are done with COVID, COVID is not done with us. So it's really important to get vaccinated to protect yourself, to protect your family. It's actually I think our civic duty and moral duty to make sure that we have good immune protection in our communities so that very vulnerable people don't get ill. So we're doing it for ourselves and we're doing it for our family and friends, and we really think it's our responsibility as community members to get vaccinated. So I hope that people will reconsider, especially since this is a new vaccine. This is just not another booster.
The other thing to remember is people will take pills for hypertension, they'll take prescription drugs for various types of things and think nothing of it as long as it's prescribed by their doctor to deal with the issues that they're dealing with. Well, if this was available in pill form, I think a lot more people would be taking it rather than a shot. But it's not, it's available as a shot, and it's just, think about it the same way. If you've got hypertension and you're taking a drug to keep your blood pressure down, you know what happens if you don't take the drug. Your blood pressure will rise and you could have serious side effects and illnesses as a result of that, including heart attack and stroke. Why would you not get something that can protect you from COVID-19, which can cause serious illness and death? It's as simple as that.
So you don't have to worry about getting the old, like, vaccine or booster. You're getting if you're coming in for a booster, you're getting the new version. Is that what's?
Yes,
you don't have to ask. Or
right, for people getting the who are looking for this new vaccine, currently the FDA and CDC are telling us that vaccine providers that we should no longer give the old booster, so that should no longer be available in pharmacies or healthcare providers' offices. But the recommendation is to give this new Omicron variant of vaccine combined with a booster dose to protect against the old COVID. So the old booster vaccine should not be available anymore in the community.
Is
It's
it a
like the
one-stage
flu.
or two-stage
I'll go over here, but think about it. When you get a flu shot, it's a flu shot that's formulated for the flu that they believe is going to be prevalent that year. They don't give you the flu shot from 3 years ago or 2 years ago because it just isn't going to work.
Can you say how long a person can expect good protection with the new formulation?
Right. The thought is with the booster doses, it should just take a couple days to see good immune protection.
But then how long can someone be protected before they have to get another vaccine?
We don't know how long the protection will last. Right now there's no recommendations for another booster after this, so time will tell. But however, we know that right now it will be very protective, and hopefully what we're hearing from the FDA and CDC is we're thinking these are going to become annual vaccines, just like the flu vaccine, as the county executive mentioned. So hopefully this will get us through another year of COVID-19.
Is it a one-stage shot, or you have to get a follow-up, the second shot as well?
Right. These new vaccines are instead of a booster. So your primary series are still the original vaccines, and then this new vaccine is considered a booster dose.
But only one.
But you said earlier that it's not a booster; it's a new vaccine.
Well, it's a combination. So it is a booster, and it's a new also has a new variant formulation that will specifically target the Omicron.
So if someone comes in, they've never been vaccinated with the old formulation or anything, do they need to have the 2 shots 14 days apart?
Yes.
21 days apart.
Yes. So if somebody has not been vaccinated yet, they start their series with the original vaccine, and then when they're eligible, the time passes where they're eligible for their booster, then they can get this new formulation. Yes.
Why not start the vaccine series with the new booster that protects against Omicron?
I was not the decider on that, so that this is what the recommendations are.
comments on topic? Did we have any off-topic, health-related?
I'm off topic, but not COVID. Will there be stepped up extra security for the Bills game on Monday from the county?
There will be the traditional level of security. You'll see the Erie County Sheriff's Office there, the deputies